Hello, friends. Since we met last, I hope that all of you have stayed well, stayed safe, and managed to keep yourself away from the virus because all of us, like we used to do in our childhood days, are becoming artful dodgers, trying to avoid this little thing in every walk and every minute of life. Now, I just want to speak to you, share my thoughts with you about a couple of things which has attracted my attention. One is, times are depressive enough, but in the last few days, the more I saw the photographs of the world's largest COVID facility, which was put up in some satsang Maidan in Delhi, with cardboard beds and a plastic chair and a bottle of water being all the medical equipment that a COVID health facility was supposed to have, it really put me in a state of acute depression. Is that what India expects? Is that what a Indian expects when we think about and talk about a healthcare facility? We are talking today in terms of segregating and treating patients from perhaps one of the world's most merciless expressions of respiratory tract aerosol spread infections ever known. And that is the best we can do, a cardboard bed with a plastic chair and a bottle of mineral water. Probably this has been inspired by England setting up the Nightingale hospitals in the Wembley Arena, where every bed had facility for an oxygen, for a parameter monitoring, for suction, and probably every third bed had a ventilator if it were to be required. So 73 years after freedom, when 20 or more general elections have taken place, this is the best that the world's largest democracy can do to define what are the minimum standards of healthcare today. Very sadly, our country today has one of the most conscientious organizations that monitor healthcare standards. It's called the NABH. But forget about pandemic and the COVID, even in the peacetime. Less than 2 to 3% of major government hospitals subject them to themselves to quality control and quality standards. Why cannot be so that before any state or central health government comes up with yet another announcement of a fantastic, large, huge healthcare facility, that the NABH should do a fast inspection and certify the place to be designated as a healthcare facility? 73 years should be a long enough time to differentiate between a satsang dharamshala and a healthcare facility where ill people with respiratory tract can be housed, cared for, and treated. Are we here only to make sort of media statements? Are we here just to make another kind of superficial, insubstantial event management in the name of healthcare? And that is where we are, because for a good part of last decade and a half, there has been hardly any perceptible real-time expansion of our healthcare capacities. So we have the standards laid out. We are subjecting the entire private sector to these standards, without which they cannot find the self-respecting tariff rates for themselves. They will be beaten around with a whip and get the lowliest of rates which any government scheme has to offer. But the same standards cannot be applied to the government's own organization, through which we are told that 65% of our population are supposed to be treated. So it is high time that we take healthcare seriously. We have to define to ourselves what constitutes a hospital. We have to define to ourselves the difference between a place where a chap can lie down and where a person can get in and get looked after and be treated sincerely. And I implore to the government to the policymakers that have that honesty, have that transparency, where not just for the pandemic, but even for the peacetime, where every governmental organization will subject itself to quality care inspection. I hope we have seen the last of these. I had hoped, rather, that we had seen the last of these fantastic mega healthcare adventures in terms of 10,000 COVID beds. I believe another one is coming up, another monstrosity is coming up in Bangalore in a couple of days' time. Let us see how better they are equipped, because probably the last one had one bottle of water and this one may have two bottles of water. An Indian deserves better and an Indian expects better. The other point has been really very mystifying, because being quite rather engrossed in this COVID business, trying to learn from it, trying to study it, trying to contribute a little bit to public awareness, one thing is absolutely beguiling, and that is, go through the world opinion, the world coverage, the world media coverage about COVID. You will be lucky to see even two sentences being uttered on a weekly basis about the country which is now housing the third highest sort of inventory of world's COVID cases. What does the world think of India's COVID program? Does the world appreciate us? Does the world criticize us? Does the world think we've been absolutely loose-limbed and lackadaisical in providing the pandemic protection from 135 crore people? It looks as if the world is not worried about India at all. Neither is it curious about India. Neither is it has any social or scientific curiosity about what is happening to the second most populous country on the face of the planet. Why is it so? Have we, over a period of time, intellectually isolated ourselves from the world's intellectual canvas? Or are we slowly receding, not just as an economic power, but as a civilized mass of people? Not so long ago, our country was considered, was discussed, was written about in the intellectual canvas of the world. But right now it looks as if all that was written with disappearing invisible ink. This is something we have to think about. Are we considered to be a basket case as far as a considered, cogent, scientific approach to a public health problem is concerned? And it is not just in the domain of public health. It took a good week for 2 or 3 major countries of the world to wake up and react to our line of control crisis in China. India, being intellectually separated from rest of the world, is a painful syndrome, and this is something that all Indians and all of us will have to dwell on and think about. Deglobalization had perhaps started, but are we standing in the front of the queue? Till we meet again, keep yourself well, keep safe, and let us pledge to give proper health care to this mass of people, and let us pledge to raise the intellectual and scientific identity of India as far as the world is concerned. I take your leave. Thank you.
Like, share, subscribe, and press the bell icon to never miss a video from News Sense.